Bismillahirrahmanirrahim. Assalamu alaikum. I hope you all are fine and well at your home. This is Pakistan International School Thai's virtual learning class. So now we are gonna see bone fractures. Okay. So, dear students, you know that we just when we drink milk, we drink such dairy foods, we consume them, our bone gets strengthened. Why it is important? Because it increases our bone mass. When it increases our bone mass, it means that there is more mineralization in our bones, and bones are get stronger. But what happened? But you know, this bone mass increased up to age 20 to 25 or 25, and then it is decreased gradually in both of the sexes, like male and female. So this is very, very important to take minerals, especially calcium, in our body, to consume them so that our bones get stronger, and there is a less chances of osteoporosis. This is very much related with bone fractures as well. If our bones are not stronger, they can break and fracture easily. But with sudden jerk, sudden trauma, accident, what happened? The bones get fractured, or that is like happened. So that is happened when there is too much stress and we just apply too much force on our bones, and our bones get fractured or broken down. So there are certain types of fractures. In this diagram you can see there is simple fracture in which just bone is broken down and some little one dislocated as well. And this is called simple and closed fracture. And what happened if the bone ends penetrate in the skin and form a wound? It is called complicated one. Like completely bone is completely dislocated and it gets out of that place and it's get penetrated into the skin, and definitely that is compound and open fracture, and that is very, very we can say dangerous thing, and it just take too much time to recover. And number third one, if the fracture damages other organs as well. For example, if there is a vertebral column or backbone fracture, is there like in any type of uh, injury, ribs fractures are there when there is accident, so they can penetrate into the lungs and like that, so that can be complicated fracture. Okay, if fracture is happened, so there is the bone repair procedure, and bone itself takes too much time to repair because that is the hard connective tissue. There are many layers, as we have discussed in the previous topic while we are we have started when we have started this chapter. Okay, so let's take a look on this diagram. On this picture, you can see here is the bone fracture. When there is bone fracture, number first step is hematoma formation. Hem means blood, toma, clot. So it means there is blood clot formation. How does it happen when bone is fractured? Definitely because there are the arteries and veins are also just get damaged. They will they will be damaged because bones are supplied with these blood vessels, and when they get damaged, blood leakage will be there, muscles can be ruptured, there can be the blood leakage, and the blood, if it does just a simple fracture, so what is happened, the blood will not come out, just there is swelling up, and the blood start to release inside this inside this wound, inside the bone. So at this stage, that blood which comes out and then clot at the place, that is called hematoma formation. Then hematoma formation is done. This is the first step of, but definitely it just attracts the other such processes by which the uh, complete bone remolding process occurs. So what happened, then after some days, what happened, fibrocartilaginous callus formation, it can be called as soft callus. Soft callus can be formed here. So what will happen, the vessels which have been broken down, they just start to increase, like they are start to um, like they are going to make the new uh, where are they cut down, and they started to regrow. When the bones are going, the vessels are going to regrow. So what happened, at the place, phagocytic cells invade to that area. We know that phagocytic cells, they are white blood cells, the type of white blood cells where there is injury in the body, or where there are pathogens come. So phagocytic cells are over there. They are volunteer cells, and they come over there just to eat, just to kill pathogens and to clean up that area. So phagocytic cells come to that area and begin to clean that debris, like that hematoma is going to be decreased now. So then the periosteum, like the upper layer of the bone, is going to replace again and stimulates the production and release of new osteoblast cells. We know that if this is, for example, long bone, and this is internal lumen, and this is the fracture. So what happened from here, the upper periosteum, what happened? And if we just take a look on this cross section, so there is the layer of stem cells. We know that osteogenic cells, then they are going to change into osteoblast cells. Then osteoblasts going to be increased, and they are divided continuously, and they are going to form uh, with the cartilage as well. Cartilage cells are also over there, and they are gonna form the porous mass of bones. In the start, there is porous bones because there is no mineralization, no calcification over there, like no addition of calcium and phosphorus and any type of mineral over there. So that bone plus cartilage porous structure, that is called callus, and that is soft callus. We know that cartilage first make in the start. whenever the bones started to form, they form in cartilage form, not in the form of strong bone. As we know, when the baby is born, there are lots of cartilage on the body. Then the cartilage is replaced with the bone. So the cartilage is formed, so that is called like soft bone or soft callus is placed, and the callus replaces the original blood clot, and it takes almost 3 to 4 weeks. Then you can see the spongy bone or trabeculae. Trabeculae are the, look, you can see the holes, the porous structures, they are called trabeculae. Cells as well, they are formed in the bones. That spongy bone like structure is formed. After that, bony callus formation or callus ossification, like this cartilaginous callus is now replaced with bony callus. So bony callus of spongy bone is formed. So what happened? Bony callus formation continues um, mm, until a firm union is formed between two bones. So this whole uh, fracture is filled with, first of all, soft callus, then now bony callus. It is replaced with bony callus. Now the cells are going to be first osteoblast, then they are going to form the bones cells completely, and osteoclasts are also going to increase here because there is lots of debris present over there. So osteoclast now clean up the cartilage and break down, while osteoblast replaces its bone, because osteoblasts are also formed and they are gonna form the bone, and with that ossification as well as calcification is going to be done. Like mineralization is done, so bone is going to be uh, going to make firmer and firmer further. Okay, then there is a remodeling stage, and it can take months and years as well. Like the fractured bone is going to be replaced with completely um, bony cells and healed the fracture. Bony callus of a spongy bone, now like bony callus is completely formed, and compact bone is formed in which osteons, or the cells of the bones from both of the sides, like from one side of the fracture and the other side, they are going to be extend and connect with one another. And this can take like years, 1 year or 2 years or more than this. This fracture is more complicated. So the final structure is of the remolded area resembles like the original bone. So it looks like what? Completely like the new bone, like the bone that was previously fractured. So this was the procedure of bone repair. Like first of all, hematoma formation is there, then fibrocartilaginous callus formation is there, like soft callus is formed, then bony callus is formed, then complete arteries and veins and all the vessels are going to be formed again, and bone remodeling, like it is remodeled like the new bone. Okay, now we are going to see some injuries to the joints. Some injuries to the joint, that is like any sudden trauma and sudden jerk accident can lead to injuries to the joints as well. Very common is dislocation of the joints. So when the joint is slipped out of the place, so mostly it occurs at the end of the bones, and which are replaced or forced out from their normal positions. So if like fracture of the bone, if this dislocation is severe, so it can penetrate in the skin or into the other organs as well, or muscles can be torn. Okay, then there are some symptoms of them, like like dislocation is there, so there can be no bleeding, no hematoma, but what happens, swelling, inflammation can be there, where intense pain and completely or immobility of the joint is there and affected of that affected joint. Most common causes are blow means the stress on that giant, and we fall by running, by jumping, or other trauma can be occurs like an accident and etc. So like it can be happened, they're not so common, but it can be happened by certain diseases and defective ligaments as well. It can be happened by um, like some of the bony diseases and like that. Okay, rheumatoid arthritis can also be the cause of joint dislocation, because what happened, for example, this is like like a normal hand, so bones can be dislocated, for example, like this. It can be the like joints can change their shape and can be turned or dislocated from their place, and that is very common if the rheumatoid arthritis is not going to be treated. Okay, so surgery or surgery must needed for that. Okay, then very common we are having sprains, like sudden injury, that is the injury to the ligament. And what happened in that, when like ligament that joins a bone to the bone, when it is like dislocated, fractured, or stretched, so what happened, there is too much pain, or it can be fractured, or it can be what we can say just damaged, in the ankle, in the knee, wrist. These are the common joints where it can be happen. So sprains can usually be treated with some physical therapies, as well as icing. If there is too much pain, there like we can have dressing, bandages, ache wraps, as well as we have to immobilize that sprains, and some massage uh, can be given to the patient. So there is some first aid treatment for disorders of skeleton, like the person first of all must immobilize the fractured area or dislocated joint. This is very, very important, not to try pull, push, or not to apply your own and like your own skills over there to just treat this problem. We have to seek the professionals. Okay, number two, there must be, if you there is possible, so you must have ice packs or the cold packs to reduce inflammation and pain and swelling as well. And just number three, that the victim must be on at the comfortable position, must lie down or sit down. um, we can just keep the joints immovable by using slings and splints. We know these are the supports, wooden supports, and with the manage like that can uh, joint, or that the affected area must not be move. And next one is dislocation involving the hip, ankle, and leg joints, especially, and compound fractures require ambulance to transport the victim. That is very, very important, just to transfer them to visit the doctor after this problem. Maybe the joint is dislocated anywhere, which cannot which the we cannot treat them by ourselves, so we have to seek the advice of the doctor. There must be x-rays, ultrasounds, and like that, lots of tests over there, just to see what type of the problem is. Okay, dear students, for today this is enough. I hope you all understood this very common problems, and you will be take care in the next in your life. We'll continue inshallah. See you inshallah in the next lecture. Allah Hafiz.